your boy Young Love. I give him that time. Pancho leg stand and punchy America. Banyi dwal pancho leg stand and punchy America. Banyi dwal ban walk on your leg. Kankaro watana watching. Oga leg gear pow leg. Panda with ya punchy America. Banyi dwal bano. Chingitongo pandon kujwera baya cheka. Papu panda jwero wadia bi dwal venting. Stand up punchy America, Banyi dwal, pancho leg stand up punchy America, Banyi dwal, ban walk on your leg, Kankaro watana watching, Oga leg gear pow leg, Panda with ya punchy America, Banyi dwal bano, Chingitongo pandon kujwera baya cheka, Paku panda jwero wadia bi dwal venting.
Good morning, good evening, good afternoon, good night, wherever you are tuning in. Welcome to Lagos State Media. We have a very special program that we would like to share with you abroad. To all our viewers, I salute all of you, and I would like you to share this message, this show. You share it with your inside call, such that to reach all the public. In the studio with me, the guest that whom we will have a conversation and will be addressing the awareness is Honorable Dr. Victoria Stephen Manjurachud. She's here with us and is the one who will be addressing the issue that nobody's been talking about this thing, but we are raising awareness currently. Before I go ahead to give her final remark, I would like to introduce my guest to all of you. Dr. Stephen Anip, Honorable, thank you for joining Lagos State. Dr. Victoria holds MBBS from Harvard University for women. And besides, she also holds a postgrad diploma in child health in Sydney University, postgrad diploma in child nutrition, Boston University, and she practices in Australia as a clinician for a number of years and came back to South Sudan after the independence. She is currently a public health specialist, has an MPH, and a policy maker. She is a former board member for Concern, the organization of the First Lady, a member, or she's also a member of SSBC Board of Directors, member of Sudan General Medical Council, former Minister of Health, Western Lagos State. Currently, she is Under Secretary of the Ministry of Health, Republic of South Sudan. She has a specialized, she has a special interest in child health, sexual representative health and women and children. And that is what we are going to be focusing tonight. Thank you so much, Dr. Victoria. Welcome to Lagos State Media once again. We are happy to welcome you on board. Before I give you my question, I would like you to greet our audience and the followers of Lagos State Media.
Thank you so much, Isaac Paul. Let me take this opportunity to thank yourself and the team of the Lake State Media for giving me this opportunity. I also want to say hello to all the viewers of Lake State Media. I'm myself one of the followers of Lake State Media, and I'm proud of all of you. Thank you.
Thank you so much, Dr. Victoria. Uh, there is there are some diseases that are killing people silently in the Republic of South Sudan, and nobody dare to talk about it. And I will figure out the two very, very dangerous diseases, HIV/AIDS and hepatitis B. They have been neglected by our people in the public. And this, I will start with HIV/AIDS, because HIV/AIDS become something that our people ignores, how it will affect people, or how you can get it. Like in other cultures, if a husband dies, a brother of husband can take over, take responsibility of the family, and continue giving birth with that lady. So for our viewers, for the consumption of the public, uh, I will give you these three questions at the same time, so that you elaborate more about it. What is HIV/AIDS, and what causes it, and how how can it be transmitted? What are the and also you will tell us more the statistic of HIV/AIDS in Lake State, because you are one of the undersecretary in the Ministry of Health. Welcome.
Thank you so much, Isaac V. Let me point out that I'm quite happy that you have asked me to speak about this public health issue. HIV is a global health issue of concern, and HIV has claimed almost 40 million lives. So far, there is estimated number of 650,000 people who died from HIV in 2021, and there are almost 179 people, thousand people living with HIV in South Sudan. So it's a global health issue. It's a health issue in the region, in the African region, especially Sub-Saharan Africa, and also it's becoming a challenge in South Sudan. So it's important to note the epidemiology of the disease and the importance and the public being a public health issue of concern. HIV stands for human immunodeficiency virus. Actually, the disease itself is caused by the HIV virus, but people call it HIV. So once you get infected by the HIV virus, you develop HIV infection.
Thank you so much. You mentioned that the number that lost in 2021 is really very great. What is the response of the government regarding this death? Because we have been seeing all these body being flown back home. Others, they have been sick, whether they have been going through treatment within the country, and others, they are taken to the neighboring country and they are returned back in coffins.
The number of people I've mentioned is globally, is across the globe. However, South Sudan also, there are a number of people who are dying from HIV/AIDS. We have not conducted a population-based survey. However, we are using estimates and projections, and we do have program data. The government has so far opened a number of facilities for testing. VCTs, they call them voluntary testing services centers. It also have opened a number of ART centers, and ART is antiretroviral therapy, or centers for treatment of HIV. Almost the 10 states have centers that for treatment of HIV and for testing. And the government, with support from the Global Fund, which is the main donor supporting HIV, has brought to the country free medication. So you don't even have to pay for it. The medicine is available. It is free of charge. It is in almost all the primary healthcare centers. We have tried to decentralize our services. Previously, it was only in the state hospitals or the teaching hospital, but now you can find it even in the primary healthcare centers. All was done by the government as an attempt to reach as many people as possible.
Mm. Yeah. As there are awareness programs for the 10 states and 3 administrative areas you mentioned, and how is the response from the local communities? what is the response of the community? Do they accepting the awareness being raised by the local program set by the government in all 10 states?
It varies from one state to another. In some of the states, the awareness is acceptable. Some of the states, like Western Equatoria, people have combated the stigma. And if you go to the facility, you'll find elderly young people coming to access treatment. I've witnessed that myself when I was in charge of the HIV program, when I was the director of the program. People have gone over a stigma. They are able to access their treatment. They go to the center to get their treatment easily. But some states still have a high level of stigma. And that high level of stigma, it starts with self-stigma. People don't want to accept that they have HIV. And perhaps you might have heard that sometimes back, some people even shot themselves dead when they learn that they're positive.
Yeah.
And as a result, we are focusing on better counseling services. And we have worked and invested in capacity building to our counselors, because pre-test counseling and post-test counseling are very important. Before you receive the test, you need to have proper counseling. You need to be taught about HIV. What is HIV? What if you are positive, what are you supposed to do? So that when you get the test, you are not able to shy away from the
Reality. Yeah. You have to face it. Yeah.
results. You will have self-stigma and you will not receive the medicine. You can even harm yourself. Some states don't want to access treatment. We have open facilities, yet people don't want to come and access the facilities because they don't want to be seen going there taking the drugs. They don't want people to talk about them that they're having HIV. Lake State in particular have a very high level of stigma. In fact, they have given a name of Adarwal to HIV. That name itself is stigmatizing. It's a very stigmatizing name.
Yeah.
Because if you take the medications, and perhaps we'll talk about that later, you can live a normal life. So stigma is still high. Perception of the community in some of the states with low literacy rate is still a challenge.
That's right. Yeah, we understand in Lake State in particular, the number is really high because of shyness. People, they don't need to come up openly and they don't need to talk about it. And the culture that even if somebody dies, people still move on with their life and stick in the culture. Okay, what is the biggest challenge now facing you in the fight of HIV/AIDS?
Our biggest challenge is stigma. Our biggest challenge is stigma because we have the medications, we have the centers. People sometimes don't want to come for the treatment. In places like Lake State, there is a lot of loss to follow up. And loss to follow up means patients come, take the treatment, but they don't come back again. And the loss to follow up is very, very high. So they come for the medications and they're lost during the treatment. They don't continue on the treatment. In some other states, like Central Equatoria, we have people who have stayed on treatment for 30 years. They live a healthy life. They're even part of our we call them expert clients. They have reached a level that they have become so expert that we use them in the training. They train healthcare workers even. So
yeah, I believe I'm praying not to the network of Juba not to interrupt this very important show. Are you there? Can you hear me? Hello, Victoria.
I think there was interruption of the network for a while. One other
Yeah.
big challenge facing us is access to the service itself because of things to do with the road network and also climate issues like flooding. And we have facilities and places out of reach because not every area in the 10 states have primary healthcare center. There are places out of reach. So this is one of the other challenges. But in terms of funding, the Global Fund is funding the medications for free, is even sometimes paying for incentives. And it's HIV programs, one of the supported programs. However, access to service remains a challenge due to road network and climate issues, plus stigma. These are the main two challenges facing us.
Very good. Thank you. Thank you so much, Dr. Victoria, for elaborating that thing. And you, the public, that's why I said before that you need to share this video. It's very important to reach thousands of people, because this is a very critical and a serious uh, disease. It's killing people silently, and we don't need to speak up. We will cross to go to hepatitis B. Also, is one of the deadliest disease as well. And what is the hepatitis, especially hepatitis B? Why is the dangerous one?
Hepatitis means inflammation of the liver. Hepatitis means inflammation of the liver,
Mm,
and hepatitis B is inflammation or infection of the liver caused by hepatitis B virus. There is a number of viruses that affect the liver that ranges from hepatitis A, B, C, D, and E. So hepatitis B is one
mm,
of the few viruses that affects the liver and causes inflammation of the liver.
mm. Okay. What is the main color flower of hepatitis B? And is hepatitis B curable or not?
Hepatitis B is, like I said, affects the liver. Sometimes it doesn't show symptoms. It becomes asymptomatic
Mm,
and presents at late stage with liver failure or liver cirrhosis, or
mm.
present with symptoms showing that you are in failure, your liver is failing. And that's the most dangerous part of it. And unfortunately, it has become a public health issue of concern globally in the region in South Sudan. We have not conducted a study as such, but some times back we have conducted a situational analysis, and
Mm.
we do surveys from time to time. The last survey we have conducted in 2021 shows a prevalence rate of 4%, even higher than HIV. It is higher than
Wow.
HIV. Yes,
Wow.
higher than HIV. And most of the patients present with late stage. They present with late stage because they don't go for checkup, and
Mm.
they come with complications when it is too late to cure it. Hepatitis B doesn't have a cure. It doesn't have a cure. However, it is manageable. You can get drugs that can help you reduce the level of virus in your blood so you don't reach the stage of liver failure.
Okay. Yeah. How do people get it? By the way, hepatitis B.
People get hepatitis through blood. Perhaps if you get a blood transfusion for a
Mm.
blood that has not been screened, you can get hepatitis B. If you get sexual intercourse with an infected person, you can get hepatitis B. And also, you can get it from mother to child through pregnancy and through delivery. So, these are the main modes of transmission of hepatitis B.
Okay. Is the country health system able to give free treatment, or is treating the virus and the people?
Unfortunately, this is one of the biggest challenge facing the health sector,
Mm.
because hepatitis B is one of the program which is not funded at all by any donor. And most of the programs in the Ministry of Health or the health sector are donor funded. HIV is getting attention and is getting support from the donors,
Mm.
and it's well supported. Unfortunately, hepatitis B or hepatitis in general doesn't get any support from the donors or the partners. And as such, most of the management of hepatitis happens in private sector, and the drugs are very expensive. And that's why it is becoming a real challenge.
Okay. Yeah. I got one question here from one of our viewers, called Abram Makirgol. Is asking what is the Ministry of Health do to make hepatitis B medicine affordable to the patients? 1 month dose is as high as over $50.
The
So,
Ministry of Health, the
mm,
Ministry of Health has tried some initiatives with
mm,
support from partners. We had a screening campaign some years back with support from the Egypt government, something called CC Initiative to treat 1 million African. مبادرة السيسي لعلاج مليون أفريقي. And that mubadara or initiative, the Egyptian government brought in experts to screen and give free treatment of hepatitis B and C. There is also another one due soon, and the government itself is not in a position to provide free medication for hepatitis B because the medications are not covered and the support of the government. The Ministry of Health itself has a very small budget, and all of you are aware that our budget for health sector has been consistently very low over the past few years, less than 2%, barely covering salaries, leave alone buying medications for hepatitis. It is a challenge. However, the Ministry of Health has conducted a situation analysis. It came up with a strategic plan. It came up with policy documents and has been lobbying and advocating for support of the hepatitis program. However, up to now, we have not received anything. We were hoping that this budget will be raised so that we're able to look into after programs like hepatitis B are not supported by the donors. However, this time around, still our budget remained low and very low to cover any other major initiatives like the hepatitis. It's a challenge that all of us need to work on, and the media, like Lake State Media and other media houses, need to support the Ministry of Health in the advocacy to raise the budget for health so that the health sector is able to combat health challenges like hepatitis and others.
Thank you. Thank you so much, Honorable Dr. Victoria. What message do you have for the people living with hepatitis B and those who do not have their status, and also those who are living with HIV/AIDS as well? So I need you to talk more about this to address those who are hiding with this disease. They don't need to be exposed, or they don't need to come openly or seek treatment. You can elaborate this into different languages as well, such that the majority, especially those the sick one, can get the message, whether in English and Arabic and Dinka, because Lagos State, one of the state affected highly by these two diseases. Further.
Thank you. For those who are struggling with hepatitis B or any other sort of hepatitis, I want to say that you need to come out and seek guidance, seek the treatment. And for those who are living with HIV, I want to say that HIV is no longer a life sentence. It's not a death sentence. HIV is manageable. People are now living with HIV for 30 years, 40 years. They are taking medications constantly. The medications are free. Don't shy away. Please conquer stigma. Start with self-stigma. I want to tell the community that not to stigmatize those who are living with HIV, and treat them like any other person, so that they are not, so that they access the service and come to take the treatment. To non coach ke chipping tong panamedit aborbalwel HIV akibera po akibera twang chilebi nang kilebe koin biran koin acha darwal chiwe ga chola darwal kegrin ka akerin pat bika yarwel wa ka darwal aka aren ko iriaj ay ko iriaj ran nong ran goruben be banelo muwal kariyo chibo yena ya ku chola riyo jugo ago bi pol te ira diyo gnong te chi te tin dagi go kera diyo gi chi ki nong HIV ku duguriyo bar panakim il biyo ka cancelers won pat big bani jam kay ku bigi jam num ku bigi nyot ti bin pieru ti bin loiten HIV e che ko ba no wala to wala ka deka aje wala waja ya aya gami pat panakim free of charge na lo mun wala ku nyiran mu ga pat kay le ba pir aba nang ron ti dia ron ti rwan ron ti di kay pir ke bara si go ko cin kana gi anong zaman da do tena ti ci en virus HIV ti cin wal kina nyai de ga pat kalebe kana la lu test ka yogli wi go actual undetectable is equal to untransmissible, meaning that if the virus is in your body and the level of the virus is very, very low, you are no longer transmitting the virus to other people. Confidential PMTCT, prevention of mother to child transmission. Tingwan liai, edaj la check pan akim, legitina, tiyoga no HIV ka yigwal. Lembe die kame the watching HIV. Kunaki degwal kame the bo kanong HIV kwa kultien mi twanya HIV abijwe kwa biya burden non community ko sa amika ka mustakbal bai. So pat bidia liaj bika ya yok te tira diogi non gomet. Lor panakim kulo test ti chini yok panakim lo test HIV duga jai dia jo jai ti kayin jai ka ki pambu ka cha victimize e gambi test rek na yogi non HIV kin yi wal chan man duna ba dia da kol chen pol go kin HIV kan ne kele bale ka kwa ko kwan tete ne ko go bale ke du ka jole stigma ko jala kene ke ran won twan HIV ene ko loy bi ko ya tinga palka ti weran twan ka ke aka jamnum aka lo counseling aka yek support ashan walde ne biya de ko bugo pial ko burande bela betwan bela dam tongrande ci twan kan ne kitin balwel.
Thank you. Thank you so much, Dr. Victoria, for the time with us. I think the network of Juba is favoring us in this show today, which is really happy. You passed the message to the public. To all our viewers, we thank you all. And we will invite Dr. Victoria in another show to come and talk more about this. It's a campaign of everybody. All the other media outlets, they need to campaign about this to help the health ministry to fight these deadly diseases. So I thank you so much, and I thank everybody watching now, and we will catch up again in another show. God bless all of you. Have a good day, good night, good afternoon, wherever you are tuning in. We have a good time. Thank you, Victoria.
Thank you, Isaac. Thank you so much. Thank you for the viewers.
You're welcome.
It's your boy Young Love, I give him that time. Pancho legs stand and punchy America. Banyi dwell, pancho legs stand and punchy America. Banyi dwell, walk on the lake, and carry water no watching. Oga level leg, gear, pow, leg. Panda with ya, punchy America. Panya dwell, chingatonga pandon, could you ever buy a check out? Papu panda jiro, what ya be dwell. Stand up punchy America, Banji Dwell, Pancha leg stand up punchy America, Banji Dwell, walk on the lake, and carry water no watching, Oga level leg, gear, pow, leg, Panda with ya, punchy America, Panya Dwell, Chingatonga Pandon, could you ever buy a check out? Patu Panda Giro, what ya be, Dwell,